entirely good.
Should I restart it?
Yeah, just restart it and then we'll cut that out.
Okay. Understanding Severe Disabilities, Amputations by Cynthia Sandoval, Ruben Trevino, Junior Porcatus, Blake Dumlau, Department of Kinesiology, San Francisco State University.
So an amputation is an intentional surgical removal of a limb or body part, and it could be part of a limb or the entire body part. And amputations are usually only done when a certain part of the body isn't going to heal and could cause potential risk to the individual's life. So if there's severe infection and there's problems with blood circulation, if there's trauma after an accident, or if there's malignant tumors. And amputations can be done to the lower extremities or the upper extremities. And in the lower extremities, there are foot amputations below the knee, above the knee, knee disarticulation, and hip disarticulation. And in the upper extremities, there are transcarpal and wrist disarticulation, transradial, elbow disarticulation, transhumeral, shoulder, and forequarter amputations. And the images of the skeletal system show where on the human body the articulations are done. They're done at these specific parts for biomechanical reasons. And this is a video clip of a person recovering or learning to adapt to their amputation.
You will be taught how to get on and off the floor in case you fall. As an amputee, you are at a higher risk of falling because your body's center has moved with the loss of your leg, and you may have phantom sensations telling you that the leg is still there. Once you have checked that you're okay after a fall, give yourself time to recover. Grab a pillow or blanket and make yourself comfy. When you are ready, you can plan how to get up. As a below...
Okay. Movement characteristics of people with amputations. As far as the lower extremities, the higher the amputation, the less movement the person has. That's really only true like when it first happens, because the person will usually adjust and gain most of their movement back. Everyday movement can be much more restricted unless the person has a prosthetic and they're able to gain much more movement. And for the upper extremities, balance when walking is off depending which arm is being affected, and everyday movement is not hindered much, just pretty much their balance. Amputations can result in a large change in movement, but with proper training and tools, a person with any amputation can function close to the same as before.
I'm not sure. I think this is Blake's slide. Or because I did the slide afterwards.
Yeah, he said he got disconnected. Do we just...
I thought he was back now though.
I don't know. Is he?
Can you hear me?
Yeah.
Yeah, I guess we'll just cut this part out and we'll just keep going. I don't know.
I think.
Sorry about that.
Oh, is that him?
I can't tell.
I think so. I think he just needs to turn his mic up or something.
Can you guys hear me better now?
A little bit.
Yeah.
Is that better?
Yeah.
Um, Secondary health condition, health uh, factor of
I can't really hear you.
Okay. Secondary health considerations associated with patients. So as there are considerations with surgery, there will be some struggles with body dysmorphia, self-confidence issues, things like depression and like varying levels of social isolation, things like sensory pain. But there's also things that you can alleviate that is by making sure you have proper mental support with like support circles or just getting to know your nurses and doctors that will be with you along the surgery and afterwards or even before. And then some physical considerations is it can vary between what happens after. Some people are able to recover relatively well and face minor things, or there's difficulties like having cardiovascular problems, muscle overuse, where if, say, somebody isn't using prosthetics due to the imbalance of muscular strength and the muscles being overused on one side to because of overcompensation, it can cause things like like mm, like arthritis, tendonitis, and other overusage um, difficulties of muscles. And then ways you can recover from that is going through and going to like a physical therapist and learning proper methods to recover. And there are such things as benefits to having prosthetics and not having prosthetics.
So as we know that there are many times where a amputee will need to be going to physical therapy sessions or rehab programs. It's important that a professional in the rehab department make sure um, that they are ensuring that the patient is informed on the whole rehab process, not only just the patient, but also the family members, just to make sure that they're all kind of in a way educated on how the rehab process would go, because patient education is very important. Also, you want to try to make sure that the patients are informed on assistive devices such as prosthetics. And if they do decide to use prosthetics, you want to make sure that the prosthetics are fit properly for that patient. Because the overall goal of the rehab department is to make sure that the patient can regain their level of independence and improve their quality of life.
Organizational / instructional strategies when designing PE or physical programs. Strengthen the area which has been amputated. By that means do specific exercises that build muscle in the area which may have been amputated. Example, like amputation, you could do squats to help strengthen those muscles.
So for
Uh,
kids that have amputations in school, including rest breaks throughout the physical activity program could be beneficial because students with amputations can get tired more quickly, especially if they don't have a prosthetic. They're using certain areas of their body more to compensate for where they have the amputation. So they get tired more quickly than students that don't have amputations. And if all students take the break, then it creates a more inclusive environment so that the student that has the amputation doesn't feel left out in any way.
And then teaching proper methods to recover from certain situations. Like if they use prosthetics, say if somebody lost both of their legs and they do get both prosthetic legs, teaching them proper methods of learning how to fall so they don't take such big pains or have worse accidents from falling over, and just learning how to get back up in a healthy way. And then just how to also bring relief to amputated areas by learning how to give massages or using heat packs or ice packs and other methods just to alleviate the pain that could come from amputation.
Thank you, and that's the end of our presentation.